Hello everyone, my name is Sherifat Absalam. I'm here to perform Foley catheter insertion on a female patient. This is my badge. I don't have any nail coating, I don't have any jewelry on, definitely I'm not wearing any sleeve, and this is in preparation for the sterility of the process. I've gathered my equipment. I have regular gloves, I have a washcloth, the sterile kit, and I have extra tractor which I'm going to place right in front of me. I have a limitation with space, so I'm going to be moving things around a little, but I'll ensure that the sterility is not broken in any way. I'm going to take off my badge because that's another thing that can break sterility. I don't want anything dangling over the sterile field. I've already performed hand hygiene, go into the patient's room, provide privacy, introduce myself to the patient, identify the patient 2 ways with their name, date of birth. I'm going to also confirm that with a wristband. I'm going to explain the procedure to the patient and seek their consent to do the procedure. And I'm going to explain that the procedure is going to be in phases. So Ms. Smith, we're going to start phase 1, which is cleaning the patient's perineal area. I'm going to wear regular gloves for that process. I have a hand sanitizer here for hand hygiene in between the procedure. Once my glove is on, I'm going to explain the patient. I'm going to push the sterile cap away from me, pick up the washcloth. I already have a washing basin here filled with warm water for the patient. Ms. Smith, I'm going to clean up your perineal area now, and it's already warm water, so just relax. Okay, so at this point I'm going to clean the patient's perineal area. I'm going to do this starting with the outer side away from me first, then the inner side towards me, and then the middle. I'm going to do it from top to bottom, that way I don't transfer any contaminants, and I'm going to also ensure that I use different side of the towel. Outer side, top to bottom, switch side of the towel, inner side, top to bottom, switch side of the towel, the middle labia from top to bottom, the spokes. Take the second washcloth, we're patting dry this time. Same process, outer side, top to bottom, pat dry, switch towel, side, inner side, top to bottom, pat dry, switch the towel to another side and do the labia, top to bottom, pat dry, and the spokes. At this point, before I take my hands off the patient, I want to make sure the perineal meatus is clear, there's no discharge. The labia does not have any cut or bruises, the skin integrity is intact. Once I've established that, I'll take off my used gloves, dispose it. Perform another hand hygiene. Miss Smith, are you okay? Comfortable? Alright, so at this point, I'm going to raise the patient's bed to a comfortable position. Make sure the patient's legs are open wide so I can have a clear visual of the vagina, and then I'm going to now start the sterile process. Ms. Smith, we're going to start the next phase now, as I explained to you. I'm going to set up what we're going to do in the insertion. First, I'm going to take the sterile kit, take it out of the bag gently. I'm going to use this for my trash, but because of space constraint, I'm going to place this right in front of me, even though it's not visible, but the bag is going to be here just because normally I would place the bag beside the patient, but because of the space constraint, I'm doing this right in front, so that way I don't contaminate the whole process. I'm going to just throw the trash, since this is the hand I'm going to use mostly. Perform another hand hygiene. And then I'm going to open the flap one after the other. The outer side first, outer side, another side. At this point, I want to make sure I keep the integrity, just because I don't want to mess up the sterility. Ensure it's turned on the side. Once that is done, I'm going to first take the gloves. I'm going to take the gloves, and that's the first thing I'm wearing. Since my hand is actually going to pinch the glove and I don't want to contaminate the sterile field, I'm going to use the opportunity to push the field away so that way I can have space for the glove. And I'm touching the edges and making sure I'm not contaminating the sterile field at this point in time. Making sure, and I'm doing this because of my space constraint, and I'm trying to ensure that I have enough space to put my gloves on. Now I'm going to pick up the glove and I'm going to place it here. Use the two flaps, opening and making sure the glove paper is not touching the sterile field. Pinch first, my dominant hand, where scoop my non-dominant hand, wear the gloves. Dispose. Next, since I now have the sterile glove on, I'm going to move the pack closer to me. That way, I can have adequate space to set up. I'm going to place the pack on the side. First, I'll put the drape, the shiny side first. I'm going to place it down below the patient. Next, I'm going to place the second drape over the patient. At this point in time, I'm going to set up before performing the insertion proper. I have cotton swab here, which I'm going to take out from the pad. I have the lubricant, which I'm going to apply here. In the pack, I have this cup. In case the doctor gives an order to catch the first urine, this is what I'm going to use, but I don't need it presently, so I'm tossing away. For the setup as well, I'm going to make sure the sterile water is attached to the catheter. And the next thing is I'm going to take the bag carefully off the catheter, making sure the catheter doesn't flip anywhere. And I'm going to toss that one too. At this point, I'm going to put the lubricant right over the tip of the catheter. And then, Miss Smith, we're about to start the next phase of the process. I'm going to place my hand right over the patient's top part. I'm going to make sure that I clean the area first before starting, and then I'm going to make sure the top part is the first thing I touch, because the moment I touch the patient, I cannot take this dominant hand of the patient. So at this point, I'm going to ensure I do the cleaning. I have not touched the patient, so I'm still going to clean. The swab, I'm going to do the same process that I clean. I'm going to do outer, inner, the middle. At this point, I want to make sure the meatus is sterile. Top to bottom, dispose. Inner side, top to bottom, dispose. Top to bottom for the middle, dispose. Once that is achieved, the catheter already have the lubricant over it. I'm going to place my hand now, which I can't move until I finish on the patient. Miss Smith, we're going to start the next phase now. I want you to take a deep breath for me, okay? It's going to be very gentle. Put the catheter, insert it right into the patient. Make sure it's about 2 inches in. Once that is done, I'm going to secure the catheter with my 2 hands, and I'm going to use my non-dominant hand to push in the sterile water. Once that is in, I'm going to tug and pull, and at this point, it's well secured because it's not pulling out. Once that is done, I'm going to know that process is complete. Are you okay, Miss Smith? You're fine? Okay, so once the patient says they're fine, and I know that place is well secured, I can now take my hands off the patient. At this point, the whole sterile main process is done. Now I'll have to clear what I used to make sure it's done. So detach this, take the bag out of the pack, make sure the other remaining part is fastened and secured on the patient's lap, and then place the bag right below the patient, attached to the bed, and that way the whole fluid can go down, because we don't want it returning to the patient. At this point, once that is done, I have finished the sterile process. I'm going to pack all the equipment, all the items that I used, take off my glove, and educate the patient about the whole proceeding. Let them know that if they feel any sensation, any issues, or they feel any discomfort, they should let the staff know. I've taken off my gloves at this point. Trash. I will have taken off, prior to that, I will have taken off the drape, but I'm not doing all that because of possibility of remediation. I will have taken off the drape, and I'm going to take the whole wrap it properly, and then dispose. Place the patient in a very comfortable position. Place the call light beside the patient. Perform hand hygiene. Make sure I don't transfer any latex or anything on the patient while doing that. And then educate the patient on making sure they just let their body relax so that the urine can flow accordingly, and if they have any issues, they should let staff know. Miss Smith, are you comfortable at this point? I'm going to come back soon to check on you to see how much urine you are able to output, and then we'll let the doctor know how the whole procedure goes. At this point, I'm going to perform hand hygiene, shut the door, provide privacy for the patient, and document. Thank you.